And so I'd like to say welcome to everyone. As I stated that I am the incoming chairperson for the uh, Children's Behavioral Health Committee for ACMHAI. And so I'm excited to provide leadership and looking forward to what is next. And so before we get started with Trisha's presentation, I'd like for everyone to do just your name and the county that you're coming from so that Trisha can kind of see who's here, if that is okay. So I'll start. I'm Chandra Somerville, and I reside in Champaign County. I am the Cultural and Linguistic Competence Coordinator for the 708 and 377 board, and I will pass it to Sharon.
Hi, I'm Sharon.
Looks like we lost Sharon, so Heaven, I'll go ahead and go to you.
Hi, everyone. My name is Heaven Allen. I'm the admin assistant for the DeKalb County Community Mental Health Board.
Okay. Taylor.
Hello, I'm Taylor Hartman. I'm the Executive Director of the Livingston County Mental Health Board.
Welcome. Trisha, not Trisha, Terry Mackey. Sorry, Terry. I'm getting you all mixed up.
I'm Tina.
Tina,
Mackey.
sorry.
No, that's okay. And I'm the director for the Will County Community Mental Health Board.
I think we got you on mute, Chandra. Here we go.
Sharon, are you with us? Okay, well, we will move forward. Jody, do you want to introduce yourself? You're muted, Jody.
It says darn mute. Hi, I'm Jody Dart. I'm the coordinator for ACMHAI. So thank you so much for Trisha for joining us today. Appreciate it.
Okay, and thank you, Trisha, for being with us today from Central Illinois Bridge Program. And we're just going to turn it over to you. Trisha also has a brochure, and we can put the brochure in the chat so that we could see that. And then we will turn it over to you. Thank you for being here, Trisha.
Oh, you're welcome. Thank you for having me. I am Trisha Malott, and I am the director of Central Illinois Bridge Academy. We operate under the Regional Office of Education number 17 and serve DeWitt, Livingston, McLean, and Logan counties as our 4 counties primarily served by ROE 17. I also have my LCSW in Illinois and Colorado. I'm also a school social worker and am working on my director of special ed endorsement, and have spent time in county government before at ROE. So I'm also familiar with the various mental health boards that exist throughout the state and some of the funding that can happen. And Bridge Academy started, we opened our doors to students in the fall of 2022 for the first time. And the idea for Bridge, which will tie into more of who we are and what we do, the idea for Bridge came as a result of conversations in the fall of 21 with regional superintendents after ISB issued a NOFO for funding for really to increase mental health for students in the schools following COVID. And so when I was meeting with superintendents, one of the things that repeatedly came up was not only what they needed within their schools, but also a group of students that they were finding were not getting the level of services that were needed. And they were the students who tended to fly under the radar or not necessarily need, well, they did need referrals out, but they weren't the kids getting in trouble. They weren't the kids getting sent to our regional alternative school or another alternative placement. They were not necessarily kids with IEPs who needed a truly more therapeutic day school in the sense that Hammett through the baby fold is. But they were kids who were either avoiding school because of anxiety, had attempted suicide, or were approaching a need for hospitalization, returning from hospitalization, or even just spending the majority of the day in a guidance counselor's office, in the principal's office. And again, not because they were in trouble, but because they were so anxious that they were struggling to make it through their day. So in many ways, they were taking up a large portion of school staffing time to help meet their internalizing mental health needs. And it came up in probably 3 different meetings with some overlapping superintendents, but also individually. And it was reminiscent of conversations that I had had when I was working for McLean County government, where service providers were identifying sort of the same target group of youth that were needing more than traditional outpatient services and something to integrate back into if they were being discharged from hospitalization. And when that idea first came up in that role, the discussion was from a community service provider lens and looking at intensive outpatient, because we don't have an intensive outpatient program within the Bloomington-Normal, McLean County area. And the county issued an RFP at the time, and service providers didn't move forward with responding to it for a number of reasons. In large part, whether there would be ongoing sustainable funding, how it would be funded through Medicaid or not through Medicaid, how would it accept insurance? And so there were a lot of questions about sustainability relative to financing. So when it came up again from superintendents, I spoke to Mark Jontry, our regional superintendent, about really revisiting what the schools were identifying and also what had come up in those previous meetings that he had also been a part of from the service providers. And how could we look at filling that gap and meeting that need from the lens of a school? And so rather than looking at it from a traditional, it's only, the onus is only on a service provider lens, how can we help meet it within a school setting and provide that service to the public districts that we serve? And so we began putting together a proposal for Bridge Academy. We first talked to superintendents about what we envisioned that it would look like, got their buy-in and support. And we then applied for 3 different forms of funding to help get us up off the ground. And so one was through ISB for their community partnerships grant, which is what had started the conversations. And so helped the districts apply for their own grants to meet the needs within their schools. But we also applied as startup funding for Bridge Academy. At the same time, McLean County had issued an RFP for funding again to help meet the needs of youth. And United Way of McLean County also had funding available for a youth initiative. And so we received funding that got us through our first, ultimately it was about 2 calendar years. And so it came out a little wonky for school years, but allowed us to acquire space, buy everything we needed to furnish the building, hire staff, and to make sure that we had a solid and sustainable plan. So we are, as of tomorrow, finishing our 3rd year, our 3rd school year. We serve internalizing mental health kiddos in 6th through 12th grade. So when we first started, we started with 7th through 12th graders from the 4 counties that we serve. And in our 2nd year, expanded to include 6th grade. At this time, we are going to stay with 6th through 12th graders. We do hope to expand, and whether that means more students or going down to 5th or even 4th grade, either way, expansion requires us to have more space in any capacity. And right now we are kind of maxed out on space in the building we're in. So we do blended grades in classes. And so for the most part, our junior high students are in classes together, regardless of grade level. So we have 6th through 8th grade students. And then our high school students are also in blended grades based on academic ability and subject area and what they may or may not need toward graduation at that point. And so while in the high school group, freshmen and sophomores are more likely to be in classes together than a freshman and a senior, there are some scenarios where 9th and 12th graders may be in a class together as well. We have been very intentional to keep small class sizes. So it's one of the things that has been pretty core to our original idea. And that I can also say, as we have grown in overall number each school year and in staffing, one of the things that I think helps us be successful and meet the needs of our students is remaining really true to the original idea of an overall school ratio of approximately 10 to 12 students per teacher. And so with 4 teachers, that would put us at a school max between 40 to 48 students. It is rare for an actual individual class to exceed 10 to 12 students, but it could. And instead, we more strictly follow that overall total school capacity ratio is what we're looking for. This year, our highest enrollment was 38. We are ending the year right around 36, and the majority of those 36 are returning in the fall. And then I have 10 students on a waiting list right now to determine whether they will start next school year with us. And so assuming that all of those are appropriate once I meet with them, we actually will probably be starting our school year at capacity. So we meet all of ISB's standards based on content area. And so all of my teachers have professional educator licenses. I have a special education teacher as part of my teaching team, another one who is actually going to go back and get her LBS 1 this fall. And then I am actually looking to hire another teacher to split some time with my current special education teacher because we need her for more IEP writing time because it has been a busy year of IEPs. They do a lot of project-based learning. And so rather than some traditional public school methods where they may be writing papers, taking quizzes, taking tests, learning from a textbook, my teachers are meeting all of the standards through engaging students in, so if they're taking a zoology class, what types of animals do some of the individuals in the class want to learn about? And that way it is a little bit more tailored to interest they have. It keeps them engaged, it keeps their buy-in. And then how can they demonstrate the acquisition of the knowledge to meet the standards through something, whether it is a Google slideshow or a poster or a diorama, but there's a lot of flexibility in how they present their acquisition of knowledge, and that's true for most of the classes. But then the other thing that sets us apart is I have 4 staff just dedicated to supporting students. And so I have 2 master's level therapists. One is licensed and one is working toward licensure. And then I have 2 bachelor's level social work staff, and all 4 of them are working to support students almost all day long, every day. It is rare for one of them to be able to have time in their office without a student in there. And because our students are coming in with pretty high needs, one of the things that we have found is that our students are not coming in with something that just recently led to an increase in depression or anxiety and a recent need for us. It is really probably that they needed us a long time ago, and that there are years upon years and layers of trauma that have brought them to our doors in the first place. And so helping them reach a more sustainable point to possibly return to their home school that referred them is longer than what some of them would like, longer than what some parents would like. So all of our students have to be referred from their public home district. The goal for most of them is to return to that public school at some point. We have, I don't have the number off the top of my head, but we have had a handful every year return back to their public school. And then actually this next fall is actually our highest number of students who are working on a transition plan back to their home high school. And so we have a number of students who will spend part of their days with us and then part of their day at their home high school in an attempt to transition back. Each student has an individual plan for what that looks like. And so what student A may be working on is not the same as student B, and what student A's transition plan when they're ready is it's not exactly the same as student B. We have some who have felt really ready to just jump right back into their public school, and others who say, you know what, I wasn't comfortable. I was pretty anxious before. I've done really well here. I know I'm ready to try it again, but I'd like to try it with only 1 or 2 classes and see how it goes for a semester and then make a determination after that. Our students receive, all of them have the option for individual therapy and support at any point that they need it throughout the day and week. Those who have social work or counseling minutes in an IEP, we're meeting those goals. The other thing that we're doing is all of our students have a weekly group DBT as part of their lifetime fitness class. And so they not only have a day that is, they have it 3 days a week. And so they have a day that's not only solely dedicated to physically moving their bodies. And one of my staff is a certified yoga instructor. And so there's a lot of yoga and mindfulness embedded into that particular day. But one of my therapists has specific training in DBT. And so there's a weekly group DBT that happens, and we have a social emotional curriculum that is done with all of our students based on grade level. And so those types of things are happening on a regular basis in addition to what they're getting individually. And most of our students have a psychiatrist and a therapist outside of school as well. And when they don't, and they would benefit from that, we help make referrals. We have a lot of contact with parents. And so I would say we encounter some of what a lot of public schools encounter, which is parent engagement has an ebb and flow. And they're the parents who are always very engaged, and they're the parents who are less engaged. It does not generally change how often we reach out. And so if we have a concern or we have questions, we will reach out. We invite parents to contact us, even if they're just seeing changes in behaviors at home, or seeing more isolation or sleeping more. If a student isn't coming to school and it's not physical illness, we will reach out both to the parent and to the student as often as we can. Sometimes student needs in person mean that may not happen every single day, but it's our goal to reach out to the students if they're not here to talk about what's going on, to try to get them to come back in person so that their time out of school is not very high. We have established sustainability. So we charge the district's tuition. And so while we required startup funding to get off the ground, the bulk of our ongoing funding comes from tuition to the districts. And so we have one daily tuition rate for our students with IEPs because they require a higher intensity of services. They require a different level of staffing. And then we have a different and a lower daily rate for our students who do not have an IEP. We are more than RAS, the Regional Alternative School, which is addressing more externalizing behaviors for the most part. and we are less in terms of tuition than a more intensive therapeutic day school like Hammett. So we fall in the middle with regard to what the districts are being charged and assessed. We also offer summer programming, which is for most of our students centered around the social emotional aspect. It allows them to continue to have a relatively close and consistent schedule to what they have during the school year, as well as interaction with their peers, support in person, because the summer programming is led by my 4 student support folks. And we embed learning into their fun activities. So they may not necessarily be able to tell you exactly why the watermelon exploded once it was wrapped in rubber bands, but that is part of what is happening as they're doing those different activities. And then for our high school students who may be behind in credits, usually because of their mental health and they weren't physically in person, they may have failed classes before they got to us. They are eligible to come over the summer to do some online work through Edmentum to help make up credit so they stay on track for graduation. So that's at no cost to students and families, and they still have lunch access. And so there's a lot I probably could share, but that is a quick overview, which was probably longer than intended, but I am also happy to answer any questions and hear what you all want to know or know more about.
Thank you, Trisha, for that information. How would you like for this committee to communicate the work that you do to other counties, and to the association about how you would like to receive support or get the word out about this kind of programming?
Yeah, so I plan to write something up that you could distribute with the brochure, and
Okay.
just chosen to wait to write it up to hear what kinds of questions that everybody has today. That way I can tailor it a little bit to what you all may see as needed information. Again, while we primarily, we're dedicated to serving the 4 counties that ROA 17 serves. At the same time, we have had students come from districts outside of our 4 counties. So we are not exclusive to only DeWitt, Livingston, Logan, and McLean. But the district has to, outside of our region, has to agree to pay tuition and to bus their student. And for some parts of the state, that's not going to be feasible. But I would love to talk to other folks about how they could go about looking into starting a similar type of school in their area. We have had another ROE actually come and visit the school and talk to Mark, Molly, and I about what the options in their area could be, how they could possibly go about it. And so I can also include information in that write-up about how to contact me if they have questions about exploring funding or what our initial steps were, and how to reach out to me. So.
Okay. I do have one other question. Do you all, I know with the intake process, you definitely look at needs, both emotional, but is there a strategic way to look at the assets that young people and their families already have entering into the school? Do you all look at those or just needs?
So it's primarily needs. So the paperwork we require from the schools actually addresses the strengths, both of the student and of the family. And so when we are requesting a referral, it's a really lengthy, comprehensive referral that the schools are required to send us. And that is looking at both what are the challenges of the student and the family, what are the mental health needs, what are the strengths, what other service providers are already involved. When we meet with families and students, I would say it is actually much more of a clinical interview than school related. So we do talk about school. We talk about how they feel about school, what has been hard and a challenge for them. And I ask my questions very open-ended. And so they may answer about academics, they may answer about peers, they may answer about emotions. I try really hard not to guide how they answer most of my questions so that I see what I get, and I then ask follow-up questions based on how they respond. But I also ask what has worked well about school, like what have they enjoyed? I ask about what their particular interests are. I will say that that's actually one of the things that has been cool to be the person who has done all of the intake meetings is I get to see and hear the overlap between almost every student that we've ever had come. So almost all of our students are incredibly creative in some way, and almost all of them have a love and passion for animals. And in such ways that not everybody does. And so it has been really interesting to see where there's so much overlap in a few different things for all of the students that have been appropriately placed here. But a lot of the intake is really more of a clinical determination to make sure that the student truly is internalizing rather than externalizing. And part of the conversation that I often have to have is because of our size, we actually tend to see a combination of behaviors and emotional presentation of what parents see at home and what the referring school has seen. And so there have been times where the referring school has seen an internalizing presentation in the school setting, and parents describe really pretty significant and aggressive externalizing behaviors at home. And we see a combination of the two, which then means that those kiddos and students who have pretty extreme externalizing behaviors at home, our experience in the 3 years we've done this is those kids are likely to show that and demonstrate that here at some point in time, which also means we have shifted who we accept over time. And so it's not just if they are internalizing in the school environment. We were opened to really be true in a safe space for the internalizing students. Most of them are triggered and traumatized by discussion of violence, really loud, aggressive people yelling. Many of our students have sensory processing disorders to some extent. We have a lot of students on the autism spectrum. And so we are very mindful of who we're bringing in and whether, not only whether we are the appropriate school for that student, but whether that student is also an appropriate mix for our existing student population. That way it stays a safe and healthy mix for everybody.
Okay. Are there any other questions for Trisha? I know it's 10:31 right now, and so I want to make sure that members have an opportunity to ask any
Trisha,
questions.
this is Sharon. Sorry, I don't have a great connection today, so I've kind of been in and out, but I'm curious. It was interesting to hear you talk about some of the trends you see students in terms of love for animals, and I'm just curious based on where students are coming from, maybe particular districts or particular counties. Are you seeing any uh, differences or unique similarities based on I guess where they're coming from geographically? Rural versus urban, or various things you're seeing from particular communities or counties?
Yeah. So, well, the hard part of answering that to some extent is that each district also tends to have some of their own internal determinations as to who they refer or don't refer. And so that guides it somewhat as well. I would say we see probably more cohesiveness and presentation of students between District 87 and Unit 5 here within Bloomington Normal and McLean County. Some of our more rural districts that have referred students tend to have more substance use as part of their coping strategies for their mental health. Usually, and not always, so this is sort of a globalization for those students, there's usually a little bit less parent engagement and parent responsiveness to some different things to try, but that's not always the case. And a little bit more with some externalizing behaviors. And again, that's not 100% consistent, but I would say when I think through almost all of the rural students that we've had, those fit to the majority. And I will say some of that depends on the district. So we have one outlying district where the students that district has referred have consistently been internalizing students, very appropriate to who we have intended to serve. They also happen to have a superintendent who is very involved in all of the discussions and initial proposal for us starting. And then I would say the other trend that we have seen is that we have really seen an increase in students being referred who have an autism spectrum diagnosis, who beyond that, I would also say have a PDA, which is pathological demand avoidance profile. And so at younger ages, they look more oppositional defiant, but that is not the stem and root of it. It is actually nervous system dysregulation as a result of having an expectation or demand placed on them. And my entire team we've all done a lot of training on that. And so we have a number of students who fit that profile and who have really thrived and done really well here as a result of how we approach them and our interactions with them, what our language is. And so students with autism, and especially those with PDA, I would say is the other trend that I'm seeing. And that's not necessarily specific to any one county or urban versus rural. In part, I am finding that is also because parents talk and communicate, and the parents who are involved in those groups have generally just sort of learned about us. And then we have students, we have had students from DeWitt County. I don't think we have anyone currently, but we have in the past. And so we have students currently from the other 3 that we serve. We also have a student from Champaign County right now and another one from Champaign waiting to potentially attend next year. So.
Chandra, I have just one question.
Are you the only? Oh, sorry.
That's okay. Go ahead.
Sorry, Debbie. My other question just was, is this the only program like this in the state?
So Mark, Molly, and I went and visited a program similar to ours, but with a number of differences also, that's affiliated with the University of Chicago. So we went and visited, I am now actually blanking on the name of their school, before we opened. And so it was one of our site visits. We wanted to see how they had implemented it, what some of their policies were, what the school felt like. They have also been around for over 100 years. And so it is definitely a different comparison to compare a new school to one that has been in existence for over 100 years. They also used to have a residential program. To my knowledge, we are the only program really like ours, especially operating under an ROE, without more restrictions. I do know that there is a new school coming to the Bloomington area. I think it's called Excel Prep, but I believe their primary focus is on neurodivergent kiddos, and I don't know their inclusion or exclusion criteria at this point either. So
You're on mute. I have one question. I'll try to make it quick. I apologize for my lateness, so I hope if you covered this, just disregard this question and I'll listen to the recording. But data in terms of what do you see? Is there any impact with the program that you can relate to community crisis calls for youth? Is there any reduction or anything you're seeing community-wise in result of what you're providing with the ROE, or any data that you're tracking along that line?
So we track our own internal data. We have not compared our data to community level trends. I would say it would be hard to compare the impact of our program on the data for youth crisis in Bloomington Normal just because of our size.
Okay.
So if I think of even just the number of kids within Unit 5, compared to us, I mean, I am ending the school year with 36 students, and Unit 5 has almost 13,000 students. And so even if I just look at one district compared to my total school size, it would be really hard to know how much of what we're doing impacts that.
Sure.
At a community level. We do, however, keep track of, how many hospitalizations our students had before they came to us, how many they have while they're with us. How often a student was self-harming before they came and in the initial months, and then where they reach. We look at attendance rate. Attendance rate is actually a big indicator of forward movement and progress. So that's one that we pretty easily track. We do a BASC-3 for all of our students 3 to 4 times a year to see how their emotional health is improving with regard to various areas. That's also part of how we talk about what success looks like for them. And so we're tracking all of that for our students. I think it is too early and we're too small yet to indicate a community level impact though. So
Thank you.
yeah.
All right. Well, thank you so much, Trisha, for your presentation today. I'm checking the chat real quick. They were just giving you thanks for this model in other regions. And so, again, you are welcome to stay, or you can, go ahead and log off, but we'll be looking forward to the write-up that you do with the brochure to accompany that. So thank you so much for being here today.
Thank you.
Thank you
Take
for
care.
having me. Thank
Okay.
you.